Hey everybody, really exciting chat today. It's Evan and Irma here in the Avira Health world, and we're diving into the world of work with one of our favorites, Colleen from Highland. Colleen, how are you?
I'm great. It's wonderful to see both of you.
Great to
You
see
as
you
well.
again. It's been a minute. So delighted to have you on the show here. And for those who may not be familiar with Highland or the amazing work you and the team do there, maybe introductions are in order. Who is Highland? And tell us a bit about your personal biography as well.
Sure. I've been with Highland 20 years, which means I started when I was about five. Uh,
Right?
but my career's been focused in healthcare. So I like to say that I'm a reformed cardiothoracic nurse who went into the technology side before it was cool. And been working on the technology side, really trying to bring together what clinicians and the people leading our healthcare organizations need to be able to give good care and help make people healthy. So at Highland, we do that a couple different ways, but really, and it doesn't sound so exciting, but it really is kind of a cool concept. There's so much unstructured information sitting in our healthcare ecosystem. And what we really focus on doing is capturing that and then feeding that up to the systems of record. So it could be an EMR, it could be your accounting system, your billing system, it could be helping solve interoperability problems, connecting enterprise imaging applications and technology with other mainstream systems. So it's one of those weird kind of niche areas that people don't think about. But I'll tell you, today we're thinking about it more than ever
Mm.
before with the number of cyber attacks we're seeing, downtime. I mean, you name it. What we do becomes really important to the continuity of care.
So
So
important.
that's
And
a
thank
little
you
bit
for
about
what you
me.
do. Yeah, I love talking about your biography and background. And let's talk about the world of work as well. We're in a very challenging phase when it comes to the healthcare workforce. You know, many workers are leaving the
Mhm.
business, have left the business due to overload, stress, financial downsizing at healthcare systems, and more.
Yeah.
What's your current take on the state of the industry and perhaps what's next?
Yeah. And I sort of ebb and flow between two key areas in my career. Around Y2K, those of us that lived through that, it feels a little bit like what's going on now. So in the late 90s, regardless of industry, everybody was focused on getting our systems operational and able to deal with these date format changes. And people spent years and hundreds of millions of dollars enabling systems. And then as soon as that kind of passed, and everyone's like, now what do we do? And so I sometimes feel that way. We're seeing sort of that peak of EMR adoption. We're starting to see a little bit of the trough, the burnout, the exhaustion. An EMR doesn't fix all the ills that we're seeing. And yet, I also sway between getting really excited about some of the technology that's going to allow us to be much more efficient and effective in healthcare. So I'll, put myself on the AI bandwagon. We're talking a lot about generative AI with our customers. Not so much, in the having robots do surgery kind of conceptual. But if you think about it, for 30, 40 years, healthcare organizations have been doing generative AI. We've been collecting data, we've been building models, we've been using that data to perform our services differently. And so I think what's coming in now with more technology, the ability to do that faster is really fun and exciting. And thinking about, how do we do things differently because we have an opportunity to do that and ultimately improve the quality of care. So kind of I sway back and forth. I get really excited. I go to visit customers where they're, talking about doing some really cool things. And then, and then every day we still see the burnout conversations. We see, oh gosh, so many phenomenal mentors that I've had in my career who are retiring early, who just said, okay, we're gonna think about something else to do. So it's an interesting time to be in healthcare.
Well, that is for sure. So we want to talk about some of those technological advances and new ways of doing things for sure, and some of your um, stories from customers a little bit later
Yeah.
on. But I want to stay on this topic of burnout and chronic workplace stress. So because of the pandemic, the systemic issues in the healthcare system have accelerated and become so much worse. So can you talk a little bit more about how is it affecting the healthcare staff? So obviously you talk about patient
Mhm.
care, but there is no patient
Yeah.
care without healthcare providers and medical staff and all the supporting
Yeah.
structure around it. So how is
Yeah.
it affecting the staff and their willingness to stay in their jobs?
Yeah.
What
Yeah.
perhaps has been done to make it better, or what needs to be done to make it better?
Yeah. Yeah. I was having a conversation a couple of weeks ago with actually somebody that I went to nursing school with in the 1900s. And we were talking about she's in a very senior leadership role at a large US based organization. And she said, when we were going to school and when we were young in our careers, there was a mission. We were in, being a nurse, being a physician, being a pharmacist, being a rad tech, there was a mission and you felt part of the mission. And I think, in the last number of years, we've lost some of that familiarity of a mission. And so I hear people I know, I hear customers, I can see when I go for my own services, people are tired. And they want to be part of something bigger. And I think that's going to be a real challenge that leaders in our US health systems have to face. How do you replace that family kind of environment, connect to a mission, and bring people along? No one goes into healthcare to get rich. At least that used to be true. There are some people today that go into healthcare to get rich. And I think what pushed people to be engaged. I think about like why my grandfather, who was a physician, answered the phone at 3:00 in the morning, because the only people calling him at 3:00 in the morning were the nurses who needed him to do something to care for the patient. So that kind of connection, it has been just eroding. I go to certain customers that, several different customers who are very mission centric. Particularly, I can think of several religious based organizations that you see when you walk through their hallways, their mission. When you go to meetings and their agendas, it talks about their mission. Still very dedicated to the idea of shared care and helping indigent populations. And I do find those organizations, and this is my I don't have the data to back this up, but is my gut feeling. Those folks that work at those organizations have a different level of passion. And I think it's because they're connected to a mission differently.
Oh, such a great point. And, when it comes to the workplace, there are a lot of concerns about workplace safety, not just psychological safety, physical safety, safety for the patients, the workers.
Physical.
Yeah. How do we, improve that, not just sense of security and safety, but the actual security for everyone in the workplace?
Yeah. Yeah. Well, I think this in the States is a really interesting dynamic. Certainly, we have healthcare customers in very large metropolitan areas all over the globe. And the safety concerns we have in the US are very different, more intense, a lot more scans you need to go through, right? A lot more. And I do think that takes a toll on employees. I think it's a little bit indicative of our community that we live in today post-COVID. But I think about some of the customers I've been to in Southeast Asia or in Latin America, and certainly areas I would say are very urban areas, but their level of security, safety is so different, healthier probably in a lot of ways. I've heard people talk about a connection that hospitals build to their local community and how important that is in terms of helping support the safety of employees, as they're coming to and from work, and the give and take that happens when you're a hospital in a community that's tight knit. I think it'd be a really interesting research project for some young researcher out there who's working on a PhD and trying to tie together these issues.
Yeah, it's probably a matter of respect too. It seems like the profession had lost the level of respect that it used to enjoy in this country. And that is so unfortunate and so sad because of the amount of training that these dedicated, first of all, people go in because of the calling and the wanting to help, and the dedication and time invested in getting the degrees and becoming a nurse like you've been, and becoming a physician, and the level of disrespect is just so disheartening. So having talked about a number of different issues and things that need to be addressed, let's turn to Highland solutions. Maybe you can't solve every problem that's out there, but I know you're doing a lot to solve a lot of problems. So let's talk about some notable Highland solutions. I'm thinking of RPA, intelligent document processing, but tell us about anything else that you think is important in this context.
Yeah. And every organization has its own DNA, right? It's got its own strengths, it's got its gaps. And so I think one of the things that we worked really hard to do is understand how we take the bits and pieces of our technology and we weave them together to help support the whole DNA of that healthcare organization. And so, sometimes I'll talk with folks and they'll say, well, just tell me about your solutions. It's like, well, let's step back for a minute, because first I need to understand, what are the problems? What are we trying to solve for? One of the interesting questions that, in the old days, we would ask, what is the problem we're trying to solve? In healthcare, we say, what is the diagnosis we're trying to validate? And so often our solutions are about hearing the problem and then how do we really focus on the problem at hand, and start with solving a relevant, immediate stressor in the organization. And then the cool thing, and I think about all the folks that become certified in our solutions, all of a sudden they realize as they start getting into the software, gosh, this technology is so flexible and it's easy to configure. You don't have to write a line of code for it, and it can go in and solve lots of problems that maybe the organization isn't even thinking about. So one of the things that I'm thinking a lot about in the last, certainly in 2024, are the challenges that we're having because of cyber attacks. And so we don't make software to combat a cyber attack, but what we do becomes really important when healthcare organizations inevitably have to go downtime. You can think about some of the really horrific stories that have happened this year, how many organizations have to turn off all access because of a bad actor that's come in. And, when I think about, one of the missions that, that I'm passionate about right now is helping our customers think about how do they manage that risk. because we don't think so much about, how to scan. How do we scan and index, right? That's kind of old stuff. But I'll tell you, every healthcare organization globally, every single one, should be looking at their downtime procedures and should be thinking about, if I'm down for a day, a week, a month, 6 months, how am I going to capture all downtime information and get it accessible? I read today, there's an organization that's in a downtime situation right now, and they've had to stop all surgical procedures. And in the blurb I read this morning, they're asking patients to bring any copies, paper copies of orders, labs, or notes to any physician visit.
Wow.
Today. So,
what a
in
world
August
we live in.
2024. Yeah. So we've got a lot of work to do in how we capture information and manage that. And, the work that we do at Highland, our solutions do that natively. I mean, that's our business, how to do that and how to do it quickly and how to make that information available back to providers. So,
wow, really,
lots of work
really
to be done.
important insight. So much great work being done there. The other area that's fascinating to me is in standards and interoperability. When I started in tech 35 years ago, tech in general was built on standards and interoperability. It gave rise to mobile phones and networking and the World Wide Web with, HTML and et cetera, on and on. And only short number of years back did I realize that interoperability in healthcare wasn't necessarily a thing. I was kind of shocked as a non-industry insider. Maybe talk about why interoperability, is more than just a buzzword, why it's so crucial for organizations to provide better care and seamless data exchange and on in our space.
Well, and Irma, you asked when we started this to talk a little bit about, the stressors and what was impacting, some of the challenges we have with employees and people in the system. And I do think part of what's been going on is lack of interoperability. Really being able to step back and say, how do we make sure the information has a certain taxonomy and a certain structure to be able to share? We've made some really great progress with organizations like HL7 and some of the international collaborators that have come together and said, hey, this is how we're going to share information. But I'm going to say something provocative. And part of it is, we see vendors. I mean, I see this, you never go in a hospital where it's just a Highland solution. We're always part of that woven solution set or that DNA I was mentioning. And, when we see other vendors that talk about interoperability or access to information, but then behind the scenes, it's not really the game that's being played. It becomes really frustrating. And, it's hard, Evan. You hit it. Like, this is not new stuff. Industries, think about banking.
Right.
No one would who would think you could pull your phone out, take a picture of a check, and have that check deposited in your account within 5 minutes. So this isn't a technical challenge, but I do think it's a, how people play together challenge. And we've got a lot of work as consumers to ask our healthcare organizations to step up and really be interoperable.
Yeah, speaking of
Very
people
provocative.
playing, speaking of people playing together or not playing together, let's talk a little bit about the insights from the HIMSS research on interoperability. We've been attending HIMSS for years, and interoperability has been a buzzword for years. But looks like maybe some additional efforts are being made now to actually bring that to reality. So talk about that research and your insights
Yeah.
and what are the key takeaways and how they're shaping or could shape the future of connected care.
Yeah. Well, and HIMSS, as an industry leader, a great professional organization, they really are living this mission of saying, what is interoperability? And they're asking the right questions globally. And they've been a terrific coach and sometimes a Sherpa for Highland software to say, hey, here's what's going on in the market, giving some really good data points, because the research that we've collaborated with them on has been well structured and very consistent and really strong data points. Post-COVID, we continue to see the struggle, particularly around things like enterprise imaging. So large scale diagnostic based images that are still disconnected. I've had some folks say, there are times when they feel like those images maybe are held hostage because of the certain system that they were taken in, and the structure around that type of data and how does that data get shared, so that as a radiologist, I don't have to know this image was taken in this room with this device and is sitting in this particular system, right? Or the ability to allow clinicians to see referential scans and images just as part of their normal workflow. So those types of things are really highlighted as part of the work that we're doing with HIMSS, as part of the research that we're doing. We continue to want to be able to share with our customers and potential customers and other vendors that we're working with to say, hey, here's some areas that if we focus our concentration, we might be really able to move the dial and ensure better interoperable experiences. One of the stories that I love, and I'll name drop this customer because I think they've done just such an amazing job. WellSpan, based in York, Pennsylvania, their IT organization, their CIO, their CTO, the things I've watched that group really take forward and implement efficiently has been, over the last, I'd say 4 years, amazing. I mean, that is a group, heavy lifting. But what I find is that it always connects to the patient experience. And so in collaboration with, their internal resources, they put together a phenomenal storyboard about how image of a fetal monitor and a woman that goes in and, has a ultrasound done and then wants to be able to take and show that ultrasound to her family later on a device, how impactful that is, and really kind of gets at the heartstrings of, what's going on. So, that's an organization that, I tell people, if you meet up with them at events, pick their brains, because that is a top-notch organization delivering great care in, the Pennsylvania East Coast area.
Wow, what a great story.
As a guest, maybe too.
We should.
Yeah.
Sounds amazing. Well, it wouldn't be a tech discussion unless we dived into my favorite topic as the number one geek here today, AI and ML and automation's impact on the healthcare landscape. You guys have invested tons in this space. What are some of the benefits you're seeing, early benefits, operational efficiencies, other impacts on, real world practical deployment of AI in the front lines of healthcare?
Yeah. So, this is I think one of the things as technologists, we get excited about the opportunity to streamline process, do it faster, better, take the complexity out. So, there's some tools that have been used in the industry. You mentioned RPA earlier. That is a tried and true machine learning, great tool to be able to use to help automation. But then if we take that further, we're starting to see how AI is being used in different ways. So I think the ability to onboard new clinical staff, right? Build these learning modules, allowing them to train and learn quickly without having to sit in rooms becomes really powerful. I think some of the work going on that I see going on with the sharing information back between the providers and payers, a lot of disconnected systems and people information sharing. But I think Gen AI is going to really improve those pieces. Even in our own business at Highland, we are constantly looking at how do we make it easier for our customers? As a technology company, what can we be doing? And we're partnering with Salesforce on a Gen AI internal tool, which I'm really excited about because it's going to allow us to make sure our technical support team gets to speed really fast. That we can do these odd elastic searches. So when a customer calls and they say, I'm having this problem, that we can go and find the right information quickly. We're applying that to our own portal. So customers are going to be able to come into our community portal and put in the right words and be able to get relevant information back quickly on a variety of tools and software. So, we are trying to follow what we preach and really think about how do we get better as a business. That's probably for us been the hardest thing during COVID, as all technology companies have struggled, great resignation and hiring and onboarding and all the things going on. And how do we make sure that we do better day by day by week than we have? And I'll tell you, we've had some stumbles and we've got some phenomenally gracious, wonderful customers who have said, hey, this is what we can do to get better. And I'm part of the experience and we're going to help you do that. And so that's been really kind of a fun part of the journey that I hadn't thought about.
Wow, Colleen, that all sounds so interesting. We've always liked Highland. We know you guys approach things with heart and with real kind of long-term thinking. And what you just said, opportunity to learn from customers and from what's actually going on to keep improving the company and the internal structures and the internal tools while also delivering these solutions to the world that can improve patient care, address workplace challenges, including staffing, onboarding, training, and improving work-life balance in the end, so less people leave this space. So this is all very admirable and so interesting. And Colleen, we just thank you so much for taking time to share this with us and with our audience. And onward and upwards, and we'll keep watching for your continued progress. And
well,
any
Irma,
parting words?
Thank you so much. Thank you so much. And we've got some. I don't want to spoil the excitement, but we've got our yearly customer conference happening in September, and we have some really cool things we're going to be announcing and talking about. So hopefully as we get, towards the end of the year, certainly before HIMSS next year, we'll be able to share some of that with you and some of the real world, things that we're working to bring to healthcare.
Exciting, very exciting. Well, thank you again so much. And we'll look forward to seeing you and hearing from you in the future, and looking forward to all those exciting announcements coming up.
Thank
soon.
you.
Terrific.
Thanks, Irma.
Okay.
Thanks,
Take
Colleen.
care.
Thanks, everyone.
Thank you,
Thanks for
everyone.
watching.